Vaginal dilators are used in physiotherapy to treat women who suffer from pain and anxiety with penetration. Knowing how to use vaginal dilators correctly helps women follow up the treatment in the clinic in the privacy of their own home. Hi, I'm Michelle, and today I'm guiding you through how to use vaginal dilators at home. Now, we're going to be looking at how to set up to use vaginal dilators, and I'm going to guide you step by step through this process. Also to how to insert them, how long you need to use them for, the optimal time to use them during each treatment, and also to over a period of time. And then finally to just briefly some precautions to follow if you're using vaginal dilators at home. Now, just before we start, there's no universal protocol for using vaginal dilators. So it's really important that you work with your clinician and follow your clinician's instruction, because this person has actually given you the dilators and assessed your condition and has given you a certain treatment protocol according to your condition. So the information that I'm giving you is general information only that might actually, you might actually like to take some of these ideas on board for relaxation, pain reduction, and so forth, and also to inserting the dilators as well. So this is a set of vaginal dilators here. This is one of the sets that I like to use, and this is the Vaginal Dilators, and they're linked below if you're interested in reading more about them. I really like them because they're a medical grade dilator and they come with a detachable handle, but the thing I like the most about them is that handle detaches like that. So it makes them much easier to use when you're actually inserting them. But I really like them because they have one of the smallest diameter starting sizes. And this is really useful for pain and apprehension with penetration, to have a really small size to start with. So that's really nice. Some of the larger sizes are a bit more threatening too and can be a little bit more uncomfortable. So Belvi's a nice brand to actually start with. So let's start by going through the basic setup for how to set up to use your dilators, and then we'll go through step by step for how to actually insert them and progress your treatment. So first of all, when you're setting up, set up in an area where you know you're going to be warm, calm and relaxed. And usually this is in the bedroom. You want to be in an uninterrupted space, because this is the time you need to take, maybe 5 to 10 minutes of your time that you know that you can feel comfortable on your own. Lying down in the position that you can see up here, this is the position that's really nice to relax in. So you have a couple of cushions under each knee or a pillow underneath your knees so that you can lie back and relax during the treatment. First of all, in your lying down position, you might like to warm the dilator, and you can also warm the lubricant that you're going to use as well, and I'll discuss more of that in a moment. But just by wrapping the dilator in a warm, wet flannel for 5 minutes or so can help to warm it up, which can make it much more comfortable. And you can also wrap the lubricant in the warm flannel as well if you'd like to warm that up as well. So lying down, the first things you do, and these are really important things, deep breathing. Now, we're going to use deep breathing to help you adjust and to train your brain to relax with the treatment, because part of this is not only just applying gentle stretch to the tissues, but it's also desensitizing you to touch in that area, and also to helping you become relaxed and familiar with that. So the breathing and the scanning that I'm talking through first are really important parts of this home treatment. So when you're breathing, you start with your deep breathing for 5 minutes, lying down, and you take a slow, deep breath in. And when you do so, you breathe into the belly, so into the lower belly, so the lower belly expands forward and then relaxes down. And as you do so, as you deep breathe, you imagine the pelvic floor relaxing down and letting go. So with each breath out, let it relax and let go, and then slow deep breath back in again. So that's how you're doing that slow deep breathing. If you've ever done yoga breathing or diaphragmatic breathing down into the base of the rib cage, so I'll show you that, into that space in there and allowing that belly to raise forward, that's what you're actually aiming for with this deep breathing technique. So after 5 minutes, and again you might have your soft, calming, relaxing music playing, start some body scanning. Now, when we talk about body scanning, we talk about noting from the head to the toe, or if you want to work from the toes through to the head, it's up to you. But just noting any areas of muscle tension. And you can do this progressively. Say, for example, you might feel around the face. Can you feel any areas of tension in and around your face? Soften your facial muscles. Around your mouth, around your jaw, around your neck. And working down your body progressively into the lower tummy, that's a really important part of the body to relax and to breathe into, and also into the pelvic floor, the buttocks and the thighs, right down to the toes. So these two starting things, your deep breathing and your body scanning, are really important. Okay, to start, what you actually do then is you use a small amount of water-based lubricant on the top of the dilator. So make sure the lubricant is water-based. You don't want to be adding chemicals that might irritate the internal tissues. And so some of the lubricants have petroleum-based or have additives in them that are best not to use if you're prone to suffering from pelvic pain. So you add that small amount of lubricant on the tip of the dilator, and you start with the smallest possible dilator. So that's really important. Now, one of the most other important things that I can say is that when you're actually inserting the dilator, the most you can feel, or most you should feel, is a minimal discomfort. You always keep this sensation comfortable, otherwise you can have reactive muscle tightness and muscle spasm if you feel pain. So it's really important that the treatment remains really comfortable with minimal discomfort throughout, and this is where you're going to use your breathing strategies too. So you start in that lying down position, and just with the tip of the dilator, just rest it against the entrance. So just the entrance only, and relax and breathe. Visualize your pelvic floor softening down. It might be like a flower opening up. You can use a lot of visualization techniques to help you relax, and also there's various CDs available that you can use to actually help you with that relaxation, deep breathing process. So also when you're actually then, you've actually managed to relax and adjust to that sensation, then just progressively insert the dilator a little bit. So we're not going for the whole amount, we're just going for a small amount. And you do as much as you can tolerate per session. And that might be just the tip against the entrance, and that is absolutely fine. Then if you can actually insert it a little bit more, and once again, you're really focusing on your breathing, on the music around you, on that general sense of relaxation, and noting any areas that might be tightening in your body and letting them go and relax. So if that's enough for you during that treatment session, then that's absolutely fine, then you stop. If you feel that you can go a little bit further, then gently insert it. You don't need to keep holding onto the handle. You can let it go, trusting that it's not going to move. Relax your breathing. Sometimes you can actually just put a little pillow against the end of the dilator there, against the handle, if you need to actually stabilise it, if you're worried about it slipping out. And so that's how you actually gradually progress that treatment, so increasing the depth of the insertion. And then when you've finished your session, remove the dilator and just take a moment to breathe and relax after that session's finished. When you feel calm and ready to do so, then you can get up and obviously wash the dilator with warm soapy water and store it in a dry place, so store it and dry it. So that's how you progress your dilators, and over a period of time you'll be gradually increasing the size of the dilator you use, just according to your own personal level of comfort. Now, let's talk about the frequency and the timing of dilator treatment. Once again, there's no firm recommendations with this in the literature, but there is some suggestion in some of the research that using a dilator on alternate days of the week, so one day on, one day off, can give you benefits. And starting with the duration of time that feels comfortable for you, working up towards 5 to 10 minutes per session. Now, the research also suggests, or some of the research also suggests, that women that use dilators over a 3-month period of time, so 3 months or longer, seem to get better outcomes in terms of reduction in pain and reduction of anxiety to allow for penetration. So what are some of the precautions we need to take using a dilator? Well, I've already mentioned the first one, and that is always keeping that dilator use within your range of personal comfort. If you push too hard and too fast, then you're going to often get some reactive spasm, and that's going to go against the whole aim of the treatment. Plus two, you want to give your brain time to learn not to feel threatened by that penetration. So you're actually going through a learning process as you're doing this. The second precaution is not to use a dilator with an active pelvic infection. The third precaution is not to use a dilator unless you've been advised otherwise immediately after pelvic surgery. So really follow your medical specialist's guidelines regarding when to start using a dilator if you need to use it after pelvic surgery. And also too, it's very important that you follow your surgeon's recommendations or your oncology nurse's recommendations if you're using a dilator after pelvic radiation therapy to stop adhesions developing. And finally, obviously you'd never share a dilator, and always be hygienic with your dilator. Wash them and put them away and dry them. I didn't mention some women will sometimes experience a little bit of blood loss after using a dilator, which is okay. But if you experience a large volume of blood loss or a large amount of pain, then it's really important that you consult with your medical practitioner before using the dilator again. So we've gone through quite a lot there, haven't we? We've talked about how to start using the vaginal dilator, how long to use the vaginal dilator, how to insert the vaginal dilator, and also to some of the precautions to be taken with vaginal dilator use. So if you found the video helpful, I'd really appreciate it if you can give it a like below, because then that will encourage YouTube to share the information with other women that might benefit too. And I really thank you for watching today, and really hope this information benefits you and helps you with your understanding of how to use a vaginal dilator. I'll look forward to seeing you in the next video. Goodbye for now.